We treat a class of people who can go to great lengths to try and get around the system, and I think Soberlink's created a device that makes it really, really challenging to do that. My name is Lane Rust. I am a clinical case manager for Clarity Family Consulting. We do case management for families across the country. Some of the issues clearly are whether or not that individual is being honest, and are they sober from alcohol when they say they are. We really want to be there to support, engage with them, and to help them come to see and understand that life can be really rewarding. The goal is to improve the quality of their life. There's a lot of devices on the market, and from people that I knew in the industry, it became very clear that Soberlink was the leading device. It really aids the individual in staying on the straight and narrow, and it's one of the most effective ways if you're looking at doing alcohol monitoring. I've got several clients currently that are enrolled in the Soberlink program. We have access to our own database. The staff works really well with our staff and makes things as seamless as possible. We come up with the times throughout the day that fit their schedule. We've got 3 2-hour blocks throughout the day where they are alerted on their device that it's time for them to take a test, and they have a 2-hour window to do that. We want to continue the open communication. The face recognition is a key component. One case, the spouse was concerned whether or not the device was working properly, and so she blew into the device, and it quickly said that it was not a compliant test. So the facial recognition piece is really crucial. There's a lot to be said about the security and the peace of mind that it provides for the family. We need hard evidence when you're dealing with the kind of people that we work with. In my own experience with alcohol use disorder, regardless of what people in my corner may think, if I can blow in the device and prove to them that, hey, listen, I'm really sober, I think it provides some peace for the individual who's using the device, and it starts to help rebuild trust within the system of care. I think Soberlink is an amazing device. It's not a surefire way to keep someone in a state of abstinence, but it's a proven method that's just another layer of accountability. If we see some suspicious activity with the device, it tends to help me as a professional say, okay, it looks like John Doe may be struggling more than he's giving me, and apply any interventions that might be necessary. The truth will come out in the end.